has to do with the mental health crisis that we're discussing today. I hope, and Senator Murray and I agree on this, that we can move promptly to offer bipartisan recommendations on how to address the mental health crisis. We've already done a lot of work on it. We passed in September the Mental Health Awareness and Improvement Act that Senator Murray and I introduced. Senate passed that in December. Senators Cassidy, Senator Murphy have introduced legislation, and Senator Murray and I are working with them. We hope to move promptly to bring a combination of those recommendations to the full committee. Not everything the Senate may want to do is in our jurisdiction, so we're working with Senator Blunt, who with Senator Murray runs the Health Appropriations Subcommittee, on ideas that Senator Blunt has proposed, and we're working with Senator Cornyn on issues that the Judiciary Committee is considering, and with the Finance Committee, which will probably have to be involved as well. So what we want to do is to move promptly in this committee to take the things that are within our jurisdiction and have them ready for the floor and work in parallel with the other committees so the leader can bring them to the floor if he chooses to do that. The reason there's such interest in the mental health crisis today is that about 1 in 5 adults had a mental health condition in the past year, according to the Mental Health Services Administration. That's nearly 10 million adults with illnesses such as schizophrenia, bipolar disorder, depression that interferes with a major life activity. And 60% of adults with mental illness didn't receive mental health services in 2014. Only about half of adolescents with a mental health condition receive treatment for their condition. Mental health conditions that remain untreated can lead to dropping out of school, substance abuse, incarceration, unemployment, homelessness, and suicide. Suicide is the 10th leading cause of death in the United States, and 90% of those who die by suicide have an underlying mental illness. I hear that from many Tennesseans. Between 2010 and 12, nearly 21%, that's 1 out of 5 adults in Tennessee reported having a mental illness. 4% had a serious mental illness. Most recent data shows that our rate of suicide reached its highest level in 5 years, a couple of years ago. It was the second leading cause of death. At our October hearing on mental health, the committee heard from administration witnesses about what the federal government is already doing to address mental illness. Today, we look forward to hearing from doctors, nurses, advocates, administrators who work every day with Americans who struggle with a mental health condition, about how the federal government can help patients, healthcare providers, communities, and states to better address these issues. We want people to be able to take advantage of the most innovative research. We heard some about that at our recent hearing about the RAISE study. I'm interested to hear how the government can support state efforts to implement evidence-based treatment programs. This will require modernizing our leading federal agency for mental health. It will require involvement from patients, families, communities, healthcare providers, health departments, law enforcement, state partners, many others who are involved. I look forward to hearing from our witnesses about the challenges we face and the solutions.